The purpose of this video is to help you identify where you are in healing from your low back pain. So what we're going to do is we're going to walk through the timeline and what you're feeling, what people typically feel during this phase, and give you a little prognosis as to what's left. Really all we're looking for here is to make sure that you're sticking to the track and that you're not going backwards. Again, our goal is to get you back to doing what you want to do as quickly as possible. And so really in this phase, we still got to do a little bit less to ensure that we get to where we want to go. So this time we're talking about the post-inflammatory and the start of healing phase. So that initial wave of extreme pain and sharp pain has started to dissipate. And really this happens, about 7 to 10 days after that initial onset for most people, most of the time when they're creating a healing environment. So if you haven't, check out our creating a healing environment, healing environment for your low back video. That'll give you guidelines on what you need to do to get to this point. Again, what people will start to feel is they're not going to feel that constant pain. They're not going to get as much sharpness with it. So the symptoms are going to be less intense. You might even have part of the day when you're up and walking around where you don't feel pain. And this is great. This tells us that the inflammation is subsiding and your tissues are starting to heal. You still might still be a little stiff in the morning. You still might be a little painful in the morning, and that'll loosen up throughout the day. So again, you're not perfect by any means, but you're starting to see that progress, and we just got to keep it going. Really, treatment is super important during this phase because now we can super attack all those areas of dysfunction that led you to get into pain in the first place. Not to mention patients really start to feel a lot better after treatment because we're not dealing with that chemical process anymore. People get up and that inflammation and spasm isn't blocking their range of motion. Now they can really start to feel, as we reduce the adhesion, that nice freedom of movement with less pain. It's important here that we prevent any going backwards. Understand, the inflammation's down, the tissue's still healing. It's not as strong as it needs to be yet, so we got to slow down. So we still want to avoid heavy lifting. We still want to avoid prolonged sitting. Static stretching still isn't the best at this point, even though I know you're feeling stiff. We don't want to push it because all those things could send you backwards. So you're off to a good start. Let's keep it going. Let's get you treated, and we're getting closer to getting you discharged and back to doing the things that you want to do.